Welcome to the Life with a Difference podcast, a platform to amplify the voices of those living with a visible difference, and also to provide relevant information from industry leaders and experts. Do you mind introducing yourself, please?
Yeah, well, thank you for having me, Andy. My name's Mark Doyle. I'm the co-founder of a company called A Life in a Day, which obviously we're going to talk about. My background professionally is I actually started life as a professional actor a long time ago now. I worked in theatre and film for years, but then in the early 2000s, along with my co-founder John, we set up our commercial organization with the goal of using our creative expertise to develop immersive learning experiences. And that's where A Life in a Day came from.
Yeah, and so to give a bit of brief overview of kind of how we came across each other, I suppose. I was talking at a conference, Patients as Partners, which is a really good conference, I think, in that it brings together pharma and industry and medical companies to try and figure out how they can better involve patients. And A Life in a Day were there. Unfortunately, I just got off a flight that was 11 hours delayed, and so I was fighting for my life. I was so jet lagged, so I didn't actually get a chance to stop and talk to you guys, but you were in the kind of brochure and I saw you around and reached out because I just thought the concept was just brilliant, and our missions kind of align in that sense, in this idea of creating more empathy, creating more understanding. So to kind of try and summarize it, what would you say is the mission of A Life in a Day?
Yeah, so the goal of A Life in a Day is it's an immersive patient experience. So what we do is we give people working in healthcare the opportunity to walk in the shoes of someone living with a particular condition or a particular disease for 24 hours. And the goal of the experience and the mission of the company is really to provide deeper insights into what it's really like to live with a particular condition in order that people working in the field can identify better outcomes. So we believe that through understanding the patient experience, it will enable people working in healthcare to identify ways to support those patients more effectively and deliver better outcomes for patients.
Mm-hmm. So after reaching out to Mark and the team, who are all super lovely, by the way, they very kindly let me have a try of it, and I thought it was fantastic. I imagine you come across these hurdles in people's mindset quite a lot, in that I was concerned it being gimmicky, etc. I thought it was brilliantly well done. I thought that you didn't shy away from the tough sort of themes and conversations, I suppose. It genuinely invoked feelings of significant anxiety in me, but in a good way, as I'd want it to for people who were kind of walking in those shoes for the day. And you also, I just think that it creates this empathy in a way that not any other experience can. We can talk about it all day, but there's something about being in those shoes. I keep wanting to mention specific details, but understandably, I know you want to keep things under wraps a little bit. What inspired you to start it? You mentioned that you started in acting, and yeah, what was there something in particular that inspired you to start this journey?
So it actually came from a project for a client. So the seeds of A Life in a Day were back in 2016, and we were approached by a client who had created a version of this experience already. But they were using text messages to text people throughout the day to sort of give them instructions on how to behave if they were living with a particular condition. And we were brought in initially just for a couple of weeks, really, to do a little bit of work on how could we create some role play activities, some more immersive techniques to really make this experience work. And as I say, I was brought in for 2 weeks. Like, honestly, I've never stopped. That was it. We came in, and the woman who came up with the idea was this brilliant woman based in Switzerland. I just thought, this is such an exceptional concept. If we can make this work, the potential for this is enormous. So we ended up being an intrinsic part of that project, and that was just on one particular disease therapy area. And after that, we said, look, we really think we can expand this. So we then took it out and expanded the number of therapy areas that we worked on.
do you mind saying what were the first few conditions you worked on? Are you allowed to say
Yeah,
that?
the very, very first one that we worked on was inflammatory bowel disease, and specifically we looked at Crohn's disease. So that one in particular lent itself extremely well to the immersive experience, because one of the symptoms of, if you're having a flare up and you live with Crohn's disease, is that you're highly likely to need to urgently visit the bathroom multiple times during the day. So I think that's where the concept first started, which was how could you simulate that activity so that people really understand the impact of just that single thing. That's where it started. And then we expanded on that and said, well, you know, if we're going to look at that particular facet of the of living with that condition, what more can we do to bring the reality to life? The next experience that we went into was heart failure. So it was quite a significant jump in terms of turning our attention to a new therapy area. And I think that was really when we went, okay, we know this can work, but we have an enormous amount to learn about how do we listen to the various different aspects of living with these different diseases and find ways to authentically bring them to life. So that was a huge challenge. And then the third one was we did our first oncology experience. So I guess within a couple of years, we started to really expand the therapy areas, but it was a huge learning curve.
Yeah, I imagine there's a lot for each condition. There is just so much that you potentially wouldn't even think about. You know, there's things that I mentioned with my condition where people would say, "I didn't even consider that." Something that's a significant part of my day. For example, I don't know, the fact that I have to clean my bedding virtually every day or and have a fresh pillowcase every day. Just something small, but then these small things add up to being, just being all consuming and taking over your life. In terms of the kind of the grittiness factor of conditions, there's parts of living with a condition, a lot of conditions where it's very raw and it's very hard and it's very gritty, I suppose. How do you balance that in terms of not shying away from it? Is it ethically difficult, or do you have a good framework and that you find it quite straightforward to create the experience and not shy away from those more difficult parts of the experience, if that makes sense?
Yeah, and I think we see it as our responsibility to try uh, and relay the authentic experience of people living with the condition. So I think back in the early days, one of the things we got wrong was we made assumptions about what we would do a bit of research and we would make assumptions about the things that we would be needing to bring into life, and then we'd go and speak to patients almost to validate is that true. And then we realized in doing that was the wrong way around. We realized what you need to do is just start by talking to patients and say, tell me what it's like to live with your condition. Tell me about how this impacts every facet of your life. So I guess, I mean, it's not so much an ethical thing. What we're very, very careful to do when we speak with people who are willing to share their stories is to make sure that, first of all, they fully understand what it is that we're ultimately going to do with the information that they share with us. And then to make sure that they feel incredibly comfortable and safe sharing whatever information that they want to share. And as I say, I think we see it as our responsibility to try to get people to share the things that perhaps are the least said things, or the things that they think are least understood about the condition. And quite often that leads us down the path of what you described as grittiness, or, the things that are the embarrassing, or the things that are really gritty, or the things you just would not think about. And I think, I've got an incredible team of people that within the organization that interview the patients. They really build up that rapport so that people feel comfortable sharing that. And then our job is to find a way of bringing those stories, those experiences to life in the experience.
Yeah, I think you do a fantastic job of it. I love that. Going back to the gimmicky thing, I didn't know how it would be possible for you to do it. I didn't know how you would create it without it being gimmicky, but it wasn't. It really brought on some serious emotion. And I'm somebody who's lived with the condition all my life, and it made me realize that there's certain things I've done in my life or I'm fortunate enough to avoid, and it brought back all those memories. So in terms of, um, Yeah, it not being gimmicky. How do you do it, I guess? How do you, for something where you have to ultimately send something in the post that, and there has to be kind of a kind of cost effectiveness to it, I suppose. You can't send everyone a super VR headset and a VR suit or
No.
whatever. It has to be reasonably cost effective. Yeah, how are you able to create these experiences so well? Do you think that's from your acting background partly?
Yeah, there's probably quite a big answer to this. First of all, thank you for your very kind words of doing it. I need to say, I think um, we we are always extremely nervous whenever people who live with the condition choose to participate in the experience, because there's a huge amount riding on that, Andy. We're fully aware that you're somebody who's lived with the condition for many, many years, and you know it better than we ever will. So the thought of you then going on the experience where we've tried to foretell it, there's a lot riding on that for us. So I really appreciate your kind words about it, and I think one of the things that we do make sure we do is validate the experience with people with lived experience and medical professionals. So before we roll it out, that is incredibly important. In terms of how we come up with it and make sure it's not gimmicky. So I guess it's important to point out there's three elements to the experience. So there's an interactive app throughout the 24 hours that you're taking part in the experience. There's an app that's sending you messages, information, and challenges and dilemmas that you need to respond to. On top of that, you're also getting phone calls throughout the day. So we have actors that call you in the role of people that you might interact with if you were living with that particular condition. So you might get a call from your healthcare professional, or even another patient. And then you mentioned the bag, we also send out a kit of items that you interact with and use during the experience. And some of the items are kind of medical props or things so we have fake medication, for example. But a lot of those items are there to sort of simulate different sensations. We have wearables, we have smells, we send out all sorts of different things, anything that's going to give you kind of a visceral impact. And I think to answer the question of how do we make it work so that it feels like an authentic, immersive experience, is actually the combination of those different elements. And I think that's both the unique thing that we do, but it's also the thing that stops it being gimmicky. If we were just, for example, to send out an item for you to wear throughout the day, at a certain point, I think that's going to, um, uh, it's a bit one note. It's just one thing. Whereas because you're in our experience, you're going to have a phone call, then you're going to be asked a question about it, then you're going to use a kit item. It's that combination that I think really immerses people. And quite often we have participants say, well, at the start of the experience, it was quite exciting and new and different. But as the experience goes on for 24 hours and there's this continuing escalation of different elements that you have to deal with, by the end, it can be quite a profound experience to be part of. Um, and I think maybe the final thing to say is, because it runs over 24 hours, we're able to create immersive challenges that interact with every aspect of your life. So we have challenges while you're at work, but we have challenges while you're at home. We have challenges while you're with your kids. We have challenges while you're spending time with friends or with your partner. And I think, again, that gives them, we hope it gives a really rounded and holistic view.
Yeah, definitely. And you mentioned the voice actor. I thought she was absolutely brilliant. I again, to not give anything away, but there was a point where I was anticipating a phone call, and my heart rate was elevated. I felt nervous, and then after the call, I felt this deep sense of injustice and unfairness, which is so ridiculous because there's part of me that knows this is all, um, just pretend, but I still felt that feeling of injustice and unfairness. And yeah, just to kind of mention that, I thought the actor did a brilliant job. In terms of challenges that you face as an organisation, as Life in a Day, I would love a Life in a Day to be in front of everyone. I think particularly healthcare providers, I think particularly primary care, would be brilliant. But yeah, what are some of the challenges that you think you face?
So, yeah, I mean, well, we're a relatively small company. There's just under 30 of us in the business, and we have a genuinely unique product. I mean, there's nobody else that we know of that's doing quite what we're doing, and that brings lots and lots of fabulous opportunity. But it also can be quite difficult. You know, we're knocking on the door of big companies, large organizations as a small organization. And quite rightly, there's an awful lot of hurdles that we have to navigate and challenges that we have to overcome. And particularly when you have a unique product, making sure that people understand the value and are willing to try something new. So I think, you know, that there's typical challenges of any small company in terms of growth. When you're talking about getting to audiences, so our audiences are primarily the pharmaceutical industry, people who work within the pharmaceutical industry, and then healthcare professionals. There is a particular challenge with getting to healthcare professionals, and I guess there's twofold. One is access. How do you find the right people? How do you make people aware of it? And how do you convince them that, as people who spend their lives working with patients and understanding disease areas, that there's real value in taking the time to actually walk in the shoes of a patient for 24 hours. So it's access and then funding. And, you know, you and I live in the UK, working with the NHS. Funding is a significant challenge. So there's that. I mean, I have to say, for our organization, we only do a small percentage of our work in the UK. We tend to work much more in the US and Europe, but globally, getting access, getting funding for healthcare professionals, there's a lot of challenges around that.
And how do you measure success, I suppose, in terms of some sort of KPIs or metrics, whatever you want to call it, for companies, for example, that might be looking into this? Because I think there's some potential there with kind of the big organisations, the big companies. For example, my friend works for PwC. I think that would be great if we can get into some of these, you know, big old blue chip companies. And because I know at the end of it, you do sort of a roundup, which I think is quite effective as well. So you have that it's a first call to discuss, and then a call, is it 6 weeks down the line to talk about how it's been implemented? Is that right?
Yes, absolutely. So how do we overcome the challenges? Is by demonstrating, you know, a form of return on investment for people, whether that's a large commercial. So we work with, you know, most of the top 20 global pharma companies, and they definitely want to see a return for their investment. And so I guess there's three different types of outcome people want to see from going on the experience. There are people and there are organizations who genuinely, the real outcome they want to see is, we want people to understand the patient experience more. That's what's really important. We just want to understand people more. That is, we want to empathize more. We want to get a better understanding of the real lived experience of people living with this particular condition. And that's really where it started, was, you know, can we give that experience? So we do a lot of measures over, have we helped you understand people and increase your knowledge of the therapy area? And to a certain extent, that's easy. That's the one that we do by default. Some clients then say, well, that's great, but what else can you do? What we want to see is what happens as a result. So the second thing we measure is what actions people take as a result of going through the experience. And that's where the follow-up workshops are crucial. So after people go through the experience, we run a series of workshops where we say to people, first of all, how did the experience impact you? What did you discover? What did you learn? And then the next question is, and what can you do as a result? And the answer to that question will depend very much on where the individual works. So perhaps we're working with people who are putting together clinical trials. So for them, it might be looking at, how do we create a clinical trial that makes sure that the people involved in it can participate fully, that there's no barriers for them taking part in the trial, that are going to make sure that they're more likely to retain it? Or are we working with a healthcare professional who's going to go tomorrow and speak to someone living with that condition? And there you might be looking at how they might adapt their language or offer different services or solutions. So we would look at what the actions are and help people implement them. And then the third one is where organizations might want to see a specific return on their investment. So that might, for example, be working with a sales team in a pharmaceutical company, and we work with organizations to look at, how can we get your sales team to increase the amount of quality time that they're spending with doctors, so that they can really communicate the value of the particular treatment or drug that they want to talk. So multiple different types of value that we can deliver, and there's multiple different needs from the people we work with on being able to demonstrate that value.
Yeah, so many options in that sense. Yeah, I just think there's so much power to if you are one of these larger companies having a workforce that has some empathy and understanding. Ultimately, if you're one of these organizations with, hundreds of thousands of people, you're going to have staff that at some point are going to get cancer or are going to get something else, and to have your whole workforce have a higher degree of empathy and understanding and kindness for that person is so powerful, and so powerful for anyone working within that organization as well, to know that all the people I'm working around have this higher degree of empathy. If you had all the funding in the world,
Yes.
how would you use it?
Just a note on empathy. I completely agree with you. I think empathy is undervalued enormously, and it is valued. Don't get me wrong, people enormously value it, but I think it's undervalued. I think the people who work in healthcare uh, tend to do it because they care about people. They tend to go into it because they want to help people, and to be able to give them an experience that increases that empathy, that understanding, it has huge value. It's highly
Mm,
motivational. It makes people want to do more. It makes people want to look for innovative and new ways in which they can better support people. And I think the people that go through it recognize that sometimes, again, being able to articulate that value for certain large organizations is difficult. As I say, but fortunately, we get other types of value. But empathy is huge, and it is.
mm. Yeah, yeah. If I could just quickly say as well, I think that there's a lot of conditions out there where people understandably, due to just not a lack of education, I suppose, or just not really thinking about it, do not understand how much some people are really suffering. I think there's some sort of A-list, if you want to call it, conditions. A-list is definitely the wrong word, but top tier conditions that everyone understands that you are deeply suffering. So if it is cancer, if it's one of the, something like that. But there's a lot of conditions out there, yeah, where people are really, really struggling, and their day-to-day life is so taxing and difficult and such a mental burden that a lot of people wouldn't even consider. And so that's something quite powerful, I think, that A Life in a Day brings, is this insight to potentially the lesser known conditions, or the lesser known of the extreme end of the conditions, if that makes sense. So for example, in my situation, I have eczema. Loads of people have experience of eczema. It's very common in childhood, a little bit
Yeah.
of a rash in your arm. And so people think they understand that, but there's an extreme chronic end of it, um, that it can be completely debilitating and can pretty kind of ruin your life, really. And so I think a lot of people don't consider that. And I think that's what the power of your experience is: empathy for people that often don't experience a lot of empathy generally.
Yeah, I would agree. I mean, it's not necessarily that they don't experience empathy. I think it's that you're absolutely right. The danger can be you think you understand it because either you've experienced a milder version of it, or with something like eczema or asthma is another one. You might have known people or know people with versions of it, and therefore you make lots of assumptions. And I think until you're able to walk in the shoes, until it's happening to you, you don't really understand the impact of it. And I think the thing that, the feedback that I'm always super proud of is when you have people, even experts, who've worked in the field, who perhaps see patients every day living with it, who go, I still didn't really get it until I lived with it myself, even for just 24 hours. I don't think I truly understood it.
Hmm.
Something really interesting happens when we say, let's not just hear from patients, let's not just read about patients, but for one day only, why don't you walk in the shoes? Something really interesting happens when it's happening to you, when it's happening to your family, when it's impacting your career, when it impacts your finances, your relationships, your friendships. It just unlocks a deeper level of understanding that I really think allows people to understand conditions, um, whether you know a lot about that or just a little.
Yeah. Yeah, I think it ties up really well when Bev got me to do kind of a summary. No, it was an intro video, and in that it said, "Please just remember this is just a day." And so I think it's really important the way that this is just a glimpse. You know, you go through that day; it's very challenging, it's very difficult, and the next day you get to just be yourself. And that is, I think most people can grit their teeth and get through a day of almost anything. It's the day on week on year that's when it starts to really grind you down mentally.
Yeah. I mean, because we speak to a lot, obviously, every experience that we do starts with patients, the voices of patients, and people with lived experience. I think I know you have to tell me, but I think it's certainly true that lots of people, when we explain that we're going to put people through a 24-hour experience, they say, well, that's great, but why not make it 7 days? Why not put them through it for a month? I agree in principle, but getting people to obviously sign up for 24 hours can have its challenges. So yeah, I think
You got to be pragmatic,
you've
haven't you?
got
And
to
I
be
think there's a
pragmatic.
there's a bang for your buck when you do a day
There
in
is.
terms of
Yeah.
sign-ups. Yeah,
And
yeah.
again, I guess a crucial thing about us coming back and running workshops that happen over weeks and months is reminding people exactly that 6 weeks later, you went through this 6 weeks ago, but for people living with the condition, they're going through it. They woke up again and went through it again. So yes, trying to reinforce that and getting that into people's minds and psyche and understanding is really important.
hmm hmm Yeah. Going back to the
Oh,
funding
yes, you're going to give
question,
me all the funding in the
yeah, I
world.
think we both got distracted.
Yeah.
Yeah. Yeah, you open your bank account and there's £1 zillion in
Yes.
there.
Okay. I mean, I would make sure that we could offer this to every single clinician globally and every student, every medical student globally. I would love that's what the dream would be. Um, I don't have all the funding in the world, but we are pursuing that dream, albeit without the zillion. And yeah, I mean, what we're working on now is as I say, it's how do we access the right people working in the healthcare? How do we get it to them at the right time, and then how do we find the funding to do it? So we've
hmm
just run a pilot with a group of trainee GPs going through the obesity program. We're also going to be running in the new year a program for our multiple sclerosis experience. That's designed for not for people, trainees, but people who are working in multiple different fields, working to support patients with MS. And it's really looking at building up all those case studies to say, why wouldn't you spend 24 hours walking the shoes of a patient if you're going to dedicate your life as a medical professional to helping those individuals?
hmm
So, yeah, with unlimited funding, I think we'd get there quicker, but hopefully we'll get there anyway.
Yeah, yeah. What experience have you seen from putting healthcare professionals through the process?
So, I think when healthcare professionals go through the experience, we're looking for them to change clinical practice, ideally, to better support patients and also language. So I think I'll give you an example. We had the opportunity to put some specialty nurses through one of our eczema experiences. And we came out afterwards, and several of them said, I didn't realize what a burden it is to apply the various different topical creams and emollients throughout the day. I didn't realize how long it takes. I didn't realize the practicality of having to apply it to areas of your body and what that would mean in the middle of a busy working day or when you're with your kids or when you're out socializing. And I'm going to change my expectations of what I think people I see will do. And I'm going to change my advice. I'm going to change the way that I tell them to apply it. I'm going to change one of them said, I tell people to wear these gloves. Why don't you just wear these gloves? Well, I wore these gloves for 3 or 4 hours during the day and went, these are totally impractical. I can't get
hmm
with my life. So I'm going to change the type of advice. I'm going to change the way that I speak to people, and I'm going to spend a lot more time listening and asking questions about what impact it's having on people's lives. And
mm
for
That's
me,
yeah.
That's just unbelievable. That's wonderful. From 24 hours, you've got someone who's a specialty nurse saying, "I'm going to change tomorrow," and
Mhm.
that, I think, is the real power of the experience.
And this is a specialty nurse. This is not just a general nurse. This is someone that works within dermatology and still, and I know it never comes from a place of malice. Of course, it doesn't. Still doesn't have that understanding and that true empathy. And that, I think that's the difference. Is that I can say it as much as I want. I can say, "Oh, I have to apply creams all day," and on paper that probably doesn't sound that bad. But there's something about the difference in the reality of actually doing it and how it sounds on paper, which is where the understanding is, and then hopefully the concession comes from. Because yeah, but just to use that example, when my skin is flaring, it feels like the alarm on my phone is going off every 20 minutes to maybe apply the next cream, and it just feels like it's overwhelming and just takes over your entire life. But again, to hearing that I have to apply some cream doesn't sound that bad. But yeah, and that's excellent that those specialty nurses now will go into that clinic with that understanding. And as a patient, that is the clinic that I want to be on. I want to be on that clinic with people who have had that experience. So yeah, that sounds excellent.
Yeah, I mean, yeah, it was brilliant. We were when we can see direct impact and direct change of the patients, that's just an incredible outcome. I have to say that one of the nurses has actually taken it upon herself to go and communicate this as well. So she's now talking at events about it. So, we could be talking about what is a relatively minor, small change for somebody to implement, but the impact can be really significant. And again, I think that's
Mm,
the real power. There
yeah,
is one other story from that, which is one of
please.
yeah,
Yeah.
yeah. There's one other story from that which really stood out, which was that during the experience we use some makeup to show how the eczema is affecting various parts of their hands. This one was particularly focused on, and one of the individuals was going to pick up their daughter from school, and said she could feel the burning eyes of other parents and a couple of the teachers as she went to pick up her child. And she knew it was makeup. She knew it wasn't real. She knew she could wash this off later. But during the moment she went, I suddenly realized what it's like to be looked at for living with a condition. And I know this. I know this of my patients. I know that they've told me about this, but I've never felt it. And for that
Mhm.
much. So again, just understanding more and being able to listen with a different type of empathy was a really impactful moment for her.
That's incredibly powerful, incredibly powerful. As you say, you as a patient, you can talk about it all day, but you'll never really have a full grasp of what that's like until you've lived it. Because it's not as if people are walking up to me and when I'm having a flare and pointing in my face and saying, "Ha, you look absolutely ridiculous." It's subtle glances, it's stares, it's whispers. And again, you can hear that on paper and think, how much does that really affect you if people are just, glancing at you or staring at you? But I think when you live it, as you say, you really understand the mental load that, how heavy that can be. Is there any other conditions that you've noticed where once you started digging into the realities of the day to day of that condition, when you get into the minutiae and everything they have to go through, you were quite shocked by just how much there is to deal with?
Yeah, I think I mentioned asthma. I think in terms of uh, looking at atopic dermatitis and things that are really comparable in terms of our experience, asthma is probably the one where I think many people come with an awful lot of preconceptions about what it must be like to live with asthma. And in our severe asthma experience, hopefully in a similar way to you're talking about, I think we blow that out of the water of the true impact of living with severe asthma, and just how devastating it can be to the day-to-day life, how terrifying it can be to live with the condition, and how much it can impact every aspect of your life. I think that's another one where people come out of it going, I thought I knew, but I really don't. There's a
Mm,
couple of others where people again have perhaps working assumptions of what they assume it must be. So obesity is a really interesting one. Um, that's one of the most challenging experiences we've ever developed, I would say, in terms of having to consider the sensitivities around the topic and the multiple different challenges that living with obesity has. That really opened my eyes. So I think people
Hmm.
think they will understand what it must be like to live with obesity, but really there's a huge amount to learn. And diabetes is another one, type 2 diabetes, particularly because it's in the news an awful lot. I think, again, people have an understanding over it, and they have an understanding of, oh, well, if you live with type 2 diabetes, here's the things that you do to manage it. You just need to inject yourself every now and again, don't you? And I think really understanding the impact of that condition, and type 1 diabetes as well, which we did recently. When you ask somebody to live as a type 1 diabetes patient with type 1 diabetes, person with type 1 diabetes for a day, yeah, it's incredibly tough
Hmm.
and difficult to manage just for
Hmm.
one day. So yeah, lots of different experiences.
Mm. Yeah, asthma is another good one. It's again, I think I feel like the issue is these conditions that are on a very, very wide spectrum, and like as you say, a lot of people think they understand asthma, and that because there's a lot of people they take their puff of inhaler in the morning and they're kind of okay, and then you have the more extreme end on this side of people who are really, really suffering. I've mentioned this before on the podcast. I wish these conditions almost came with different names. So for like how you have a headache and a migraine, I wish that for eczema there was eczema and then this, or asthma and then this, because then people understand, oh, okay, this is not just this is a life altering condition, and they'd often offer some more concession and more empathy. And I guess that's a key part of a life in a day, is that from my perspective, is if we can create a society with more empathy, that should create a society with more concession for patients. Would you agree with that?
Percent. Yes. Yeah, and you're yeah, you're absolutely right. It would benefit almost from a new name, wouldn't it? Or it would benefit from a different way of describing it. But we are where we are, and I think that's really tough. So yes, offering people a different way of understanding or learning about the condition is incredibly important. And I said, empathy is undervalued. It really is. It's seen as it's often, I think, seen as a nice to have, whereas what empathy can lead to is something we must have. Empathy leads to act. Empathy is a phenomenal driver for change. If we can make people care more, if we can make people understand more and relate it to themselves more, they are much more likely to look for new ways to help other people.
Hmm.
So yes.
Yeah. Totally agree. Totally agree. I think we have a little bit of an issue, particularly in this country, of a little bit of stoicism sometimes, and a little bit of just quietly cracking on. And it's applauded to not make a fuss and to just keep your head down and keep going. And there's value to that for sure. You can't just sit and wallow in in misery, I suppose. But that then people, I think, start to assume that everything's fine and everything's okay, and it can't be that bad. And I think that this is definitely something that can punch through that, is that, I'm not having to sit here and say, trust me, it's really, really bad. You can say, try this and see for yourself. I think there's a massive, massive power to that.
That's interesting as well. So when we talk to people living with the various different conditions, it's quite interesting that often they will come into those interviews assuming that we want to talk about treatment pathways, or the particular drugs that they're on. And of course, we're interested in that, but not primarily. We're always much more interested in, just tell us what it's like to be you. Tell us what impact it has on your life, your family, your relationships, your money, your emotional well-being. And what we find after we've spoken to people for one or two or three interviews is they come out and say, I don't really have a space to do this, to have those conversations. I don't have a space with my clinician because they have limited time with the clinician, and often it will be focused on primarily on the symptoms or the treatment pathway. I perhaps don't have the opportunity with my friends or family because I've already spoken about it with them a bit, and I don't want to burden them more. There isn't the space. So I agree with you. I don't think there is a huge space for people to really focus and tell their stories and to have those shared. Patient support groups obviously do provide lots of spaces to do that, but to share those stories with other people outside of the community, yeah, I think it's difficult, and I feel very proud of the fact that we can hopefully take those stories and bring them to life in new and innovative ways so that people can really connect.
Mm. Yeah, I think it's the next step in terms of advocacy. I think that there's a power to social media in that you can show the nitty gritty of day to day life, and some people do that excellently, and I think that's really important, that those visuals. But I think then getting people to live it themselves is the next step in that process. And yeah, I generally, just to say, I would recommend it to anyone. I think I'm not just saying it. I thought it was excellent. I thought it was really, really well done. No matter how big your team is, I would recommend it in terms of creating empathy, understanding, education, and that leads to concession. And unfortunately, in terms of the going back a little bit to the dismissive part of this situation, is that I do feel like it starts to infect the system, so to speak. So in things in the NHS, for example, we're getting talks now of moisturisers only being prescribed if you've then been referred to your consultant and your consultant has prescribed them. But that process, some people get stuck at that primary care level, and then if they are able to get to that dermatologist, that can take a year. So you have situations where people are going to doctors and unable to get the medication they need. And I think that all comes from a lack of understanding and a lack of empathy to the reality of the condition. That is something that can, you can just sort of live with it. So yeah, just to say, I just think it's brilliant. Where do you see yourself in 5 years' time with it?
Yeah, I mean, the hope is that we're we're delivering it to a lot more healthcare professionals. So as I said, primarily our business at the moment is delivering to the pharmaceutical company. I'm really proud of that. We're in 55 countries. We've got 43 different therapy areas now that we're delivering. We've delivered it in 14 different languages. So, we really have a really solid base, a really fantastic business. It's one that I'm really, really proud of. The next big goal is to get more healthcare, to be able to offer it to more healthcare professionals in more countries around the world. So I'm hoping in 5 years' time that we're making it part of the fabric of learning how to be a really effective healthcare professional in lots of different countries around the world.
Mm-hmm. And as the patient speaking to the healthcare professionals, we want you to do this. We would like you to do this to get a better understanding of the reality, because I think it will only benefit you in your approach as a healthcare provider. And there's been, unfortunately, a lot of patients have quite a big back catalogue of ways in that we've been treated poorly. And don't get me wrong, we have a massive catalogue of ways we've been treated wonderfully, but unfortunately the bad times can really, really sting. And it can be as simple as the fact that I've had situations where I go in for my appointment and I'm having kind of my visual assessment, and the comments can be quite cutting and unempathetic to how sensitive I might be to my appearance, etc. And I think that this experience will fix a lot of those issues. So yeah, just to say, as a patient, this would be fantastic if it's in front of healthcare professionals. If someone thinks this could benefit their team, what is the kind of the next steps? I guess they just get in touch with you guys.
Yes, please. Yeah, so the website is alifeinaday.co.uk. I'm also on LinkedIn. We're also on LinkedIn. You can find me there. We run as well, every month or so, we run taster sessions where we sort of do a half-hour virtual interactive taster, so you can get a bit of a flavour of how the experience works. I mean, you've been through it. It is genuinely unique. There isn't anything else quite like it, so it's quite useful to give yourself a bit of a flavour of it. But yeah, just get in touch. As I say, we've got 43 different therapy areas. We are always in development of 3 or 4 new ones. So if we don't have a therapy area that you're interested in at the moment, we almost certainly will do in the future.
Yeah, brilliant. Thank you. And it's been so lovely to chat to you, Mark. And it's lovely to meet Kate and Bev. And Bev's done a wonderful job at designing it. And so, yeah, best of luck with it. And thank you for everything you're doing.
Thank you, Andy. And thank you for everything you're doing. I really, really appreciate your kind words. And I hope we can work together to get more people on it.